Welcome to Around Kitsap. This is our BKAT program where we go in depth on a certain topic in our community. We're very excited today to be talking about our Harrision Medical Center. Joining us today, Scott Bosch. Scott Bosch is the CEO and president of Harrision Medical Center. And also with Scott is Tom Cruzy. Tom is the Vice President of Strategy and Business Development. Welcome.
Thank you.
I have been wanting to talk to these gentlemen for many months now because Harrision, of course, is a major player in our community, huge presence, and I'd almost say exploding. Would you, Scott? Exploding with new things.
We live in interesting times, put it that way, Char.
Just a very big presence in Kitsap County and expanding outside of Kitsap, of course. But I've got lots of questions to ask these folks, and let's get started. And of course, the big thing on our plate as far as national and state is healthcare. What's happening with healthcare here in Kitsap and statewide and national?
Well, let me start maybe at the national level, work down to the state, and we'll come back to Kitsap County.
Perfect.
Okay? At the national level, there is great confusion. The president's healthcare reform plan has lost the votes necessary to really carry the Senate enough to pass. They are now working to find compromises to at least salvage a portion of the healthcare reform. But at this point, the American Hospital Association and everyone I've talked to is not at all, I think, certain that anything will actually come of this. So it's an interesting time. With that said, I think the senators and congressmen and the president certainly recognizes, as does hospitals across the nation, that the reasons for healthcare reform haven't gone away. Okay, an aging population, the baby boom population turning 65 starting next year. Okay, and millions of people aging, people who are older use far more healthcare services than those that are younger. So we're having a bolus of people moving in. The cost of providing that care through Medicare or Medicaid is going to become unwieldy and potentially devastating to the federal and state budgets. We'll get to the state in a second. It's already there here.
Right.
And so at the federal level, I don't know that we're going to see a whole lot, but the reasons have not gone away, and so we hope to I think, see some legislation enacted. The thing that we were very excited about was actually ensuring 100% of the population of the country, or at least 94, 96% of the population, because right now ERs across the country are really safety nets for people who don't have insurance or any money.
Exactly.
So they don't have a place to go, they don't have a medical home. And so they end up in the emergency rooms of our country, and that's the most costly and most inefficient way to take care of somebody's health care needs. And that problem has got to be addressed.
Exactly.
Okay. At the state level, the governor's budget that was published back in December articulated the need to cut another $3 billion. Okay, and so that's after $9 billion just a year ago. The $9 billion levels of cuts resulted in cuts to hospitals alone of $310 million over a 2-year period, which is a great deal of money. The impact on Harrision was a couple $1 million. Okay. The $3 billion is problematic. The budget shows the elimination of the basic health plan, the general assistance for the uninsurable or unemployable, elimination of that. Apple Health for Kids is talked about being reduced. Adding probably 100,000 people to the uninsured rolls of the state, which already is at 917,000 people out of 6 million. It would go to well over 1 million people being uninsured in this state. That is, it's tragic, actually. So we're working with our legislators to try to find ways, I hate to say the word taxes, but somehow new revenues have to be brought into this equation, or we're not going to be able to take care of those who are most vulnerable in our state. And so the Hospital Association has a plan to bring additional federal funds in. We're asking our legislators to approve what's called a safety assessment onto hospitals, which is matched and then actually more than matched by the federal government. It's a complex process, but we're hoping that passes the legislature here soon, and the government will sign that. So that's at the state level. At the local level, Harrision is doing, we're okay. We've been able to make adjustments. Many people may remember that last April we did have to reduce our staff. We reduced our workforce. We closed our mental health unit. Those changes have allowed us economically to become stable. We have seen a decline in the number of patients coming into our organization for a couple reasons. One, St. Anthony's Hospital opened down in Gig Harbor,
Right.
part of the Franciscan health system, and there are people in South Kitsap in particular who have, it's closer, more convenient to them, and so we've seen a migration out. And the economy is affecting people's ability to seek out elective cases and take care of things preventatively, if I may say so. And also, I think a next wave of potential problems for hospitals and doctors and other providers is the fact that COBRA, people who get laid off have the ability to have something
Right.
called COBRA, which is a health insurance plan, 18 months worth, okay? Well, when those benefits are exhausted, then there is no, they truly become totally uninsured. And states that have been ahead of us in this recession are seeing that volumes are really dropping off, which would be problematic for hospitals because under the current reimbursement system, it's a fee-for-service arrangement. So if we do
Right.
something, we get paid for it. If a doctor does something, they get paid for it. And that's one of the true issues at the heart of the national debate is perhaps to change that system because it's sort of perversely incented to do more, which is not necessarily a good thing.
Exactly.
So anyway, that's the three levels, and lots going on.
There's a lot going on, and
Yeah.
it changes daily.
Right. But I would want you to know that we have made some adjustments. We've compensated for the loss of Medicaid funds through the state cuts last year. So today we're fine. Now, additional cuts are going to put additional burden on us. And you know, a higher level of uninsured will have a deleterious effect on us as well. We are seeing the number of people who come in who require charity care or bad debt, become bad debt, grow significantly. And Harrison is a nonprofit organization. Remember that. It's important to remember that we're a charitable organization, nonprofit organization. And we take all comers, regardless of ability to pay. So we're
can't
there.
refuse.
We're a community asset. Okay?
Truly.
Yeah.
Excellent, excellent. So let's talk about this past year and what has Harrison done in progression, which I know is another loaded question. Give us
Well,
a snapshot.
Yeah,
of
if you go back
09.
about a year ago right
Right.
now, we certainly completed the construction and opened our Port Orchard campus to 24-hour-a-day urgent care and primary care.
Big asset
It's
to
a
that
big asset
community.
to the community, and it's turning out to be a very busy place and has room to grow. We're very proud of that.
Good,
Belfair then
good.
was opened in April, and again, I think for that community, a very positive impact. The Belfair volumes have not been as high as we thought they would be. It's hard to know, you know, why people
right,
seek out one
right.
thing or another, but it is growing, and I think we've done a good job down there of firmly establishing the clinic and the urgent care there. So we've got those two things going.
Was there a plan for Paulsbo?
There was, and it's a good example of how our organization, I think, has done a pretty good job of planning for the future, but not being tied into plans so much that we make bad decisions, okay? Paulsbo is intended to be, when the economy was strong, and we can talk about Silverdale in a minute as well, a full-blown cancer center, really. In the meantime, the economy tanked. Harrison's resources were reduced. Our savings accounts, like everybody else's,
Right.
IRAs went down as well. And so we found ourselves without the ability to make some of these key investments. At the same time, a group of physicians from Seattle came over and opened a cancer center in Paulsbo. And so we had to make a decision about, are we going to compete or not? And sometimes it's best to not compete. It's a waste of resources to do that. So we did open a medical oncology office up in Paulsbo with 2 medical oncologists who provide a wide variety of services. And I think that those 2 physicians are doing fine up there, and it's good to be there. Additionally, now we're working with a group of radiologists and other providers to go out to the Ohalvis site and build a medical campus out there, which is convenient to the highway. It's all set up, ready to go. And our piece of property in Paulsbo is now sort of land banked, okay, for now.
Good.
But Harrison is very much going to have a presence in Paulsbo, out at Ohalva, and then more in towards town at the medical oncology business. But we've decided not to compete in the radiation oncology side of things.
Excellent.
And finally, just about Silverdale.
Yes.
Silverdale, we had very large plans to build out a significant new campus out there on our 32 acres that we have on Ridgetop Road.
Add on to the current
We'd add
facility?
on, yes, right. Our Bremerton campus is limited in terms of size. It's a very small piece of property we own, and so
and
our
it's
growth
crowded
is,
there.
it is. So we're going to offload some things out to Silverdale.
Okay.
And I think we still will do that, but the project at one point had approached $200 million, and that just became not feasible. And so we put those plans on hold, waiting for the volumes and I think our resources, the cash that we have in our accounts to grow. And that has come back a long way. Thank God there has been some recovery, and we have recovered to a large degree. But it is still premature for us to go out there without a plan. What we are doing is the investment, we'll get to that I think in a little bit, is our Heart and Vascular Center on the Bremerton campus. We'll get to that in a minute. Okay. So that's what we've been doing.
Wow, excellent.
Lots.
Very, very busy. How about the electronic medical, now wait a minute, let me try and say that again. Electronic medical record.
Yes. The healthcare industry has probably not kept up with other industries such as banking or the airline industry in terms of automating the flow of information.
Okay.
We've always had a lot of electronics flying around the hospital, but it's been not organized well. We are investing at this point $31 million, isn't that right, Tom? I think that's the number, in the establishment of an electronic medical record. This is a 3-year project. It just doesn't happen overnight, and we're about halfway into that at this point.
Tell us, what does that do for the patient? How is that going to help?
It's about patient safety. If you want to have one word, it's about safety. Okay. Records, the communication between a nurse and a physician and a physician and a pharmacist and a pharmacist and the social work department is all written right now. That chart remains in one place. That chart can be lost. That chart, handwriting can be misinterpreted. There is the use of technology is not leveraged. For example, let me give you an example of that. Let's say the doctor orders an antibiotic, for a patient. Okay. Right now, he has to rely on his own memory about whether there are any potential drug interactions with other medications that the patient might be on. In our systems that are about to be put on next fall, actually, there's automatic red alerts. In other words, if this interacts with that, there'll be a flag that comes up automatically. That's a good example of patient safety. Plus, all the signatures are electronic. We can read the writing, and things are facilitated. Plus, that record is then available not just in one place, but the physician can review the chart from home or New York City or Mexico, for that matter. And
so it'll be accessible to the patient as well?
At some point, their record will be accessible to them. We're working on the details of that right now. But more importantly, accessible to the physician who, let's say, wants to consult with a physician at the Mayo Clinic. Okay, can send the record out there or the results of the X-rays of the labs, and we can use that technology. So it's faster, it's safer. It just is highly complex and requires thousands of people to rethink the way they do things. Okay, because we've done it one way forever. Literally ever, and it has to change the way we do business.
And when did you say, what's this, a 3-year process?
3-year plan, right? And it's a matter of going through initially creating the devices, having the computers available, whether you go into the room or it's out in the hallway, teaching the nurses how to use that. The nursing documentation pieces where the nurses do all their charting has been done. The pharmacy piece has not been done, and the physician piece has not been done. So we're in process. But at the end of the day, it's going to be a very effective way for us to account, like the airlines and banking have done, okay? And where this ultimately goes is the creation of a health information exchange so that physician offices can connect, will be online, and patients can take their records with them if they go to New York or the Mayo Clinic. I mean, at some point it will become truly a national system of information exchange. There are many issues. Privacy, confidentiality, to name two, more or less the same issue. But we are working through those things right now.
Excellent, excellent. Well, we're going to take a break, and when we come back, we're going to be talking about Vision 2015, the Heart and Vascular Center at Harrison, and some other topics. Stay with us. We'll be right back. we're back with Around Kitsap. Joining me from Harrison Medical Center, Scott Bosch, Tom Cruzy, the big guys at Harrison. And I know there's a lot of big folks at Harrison, but these two have joined us today to talk about what's happening at our Harrison Medical Center. And now it's time to hear from Tom. Tom, tell us about the Vision 2015 process. What's happening with Harrison there?
The Vision 2015 process really is a very exciting time for us. It's a process we've used before to engage the community, the physicians, the staff, and all those who are vested in the future of what this organization does as a community resource. And so we've had a great success with Vision 2010 that Scott initiated when he arrived about 5 years ago, and we've made great progress. Many of the big changes and investments in technology and services that the public witnesses and takes part in benefits from as patients is a result of the process that we used to garner from folks what they were most interested in seeing us invest in. And we took that guidance and we put it in place. And so what we're doing now is renewing that process of going out and soliciting that input. And then as we get into the first stages, which is really where we are right now, we've just went out and asked a number of our physicians in our physician community. We went around to most of the communities and pulled community leaders and representatives together and asked them their thoughts about how's it going, what could we do better, what would you really like to see for the future, where do you see our industry going, and getting their responses to that, bringing them together with a work team of not only administrative individuals, but members of our community board of directors, as well as members of our medical staff, to really synthesize all of that together and to chart a future course. Where should Harrison allocate its time, its energy, its talent, and its resources to build the healthcare organization that this community needs for the future? So we're, like I said, we're about a third of the way through that process. We're just at the stage where we're ready to go out and bounce some initial thoughts off of our physician community and some of the others to see how we're doing, see if we're on the right track. This is a very collaborative process, and like I said, we're very excited about the results that it's yielding so far.
The visioning process is usually a 5-year increments. You did it 2010, now it's 2015.
Yeah, we believe that in spite of the fact that we know that the world will change in 5 years and what we're doing today will not be totally applicable in 5 years,
Right.
we think it's important to look out 5 years so that we're expanding our horizons and stretching ourselves. Okay.
Good.
An example of one of the things that we're doing in this process is a real focus in understanding that if you're a patient or not, I mean, what's important is quality and service. And we have a concept called AIDIT. Stands for announcing, information, duration, explanation, and thank you. And it's a way for our staff who are trained in this to enhance the patient's experience. So if you're a patient coming in, what are you worried about? Well, who are you working with? And so announcing that somebody's there, introducing themselves, saying how many years they've had in practice.
Very nice.
People are wondering how long things take. So we're talking about the duration of things. Explanation. People absolutely want to know, what does this mean to them? Okay, and so we're taking the time to do that, and then saying thank you. I mean, how
nice.
basic can that be?
Very
nice. It's the right thing to do.
Very
so
nice.
That's just an example of one of the things that we think will come out of Vision 2015.
I can give you a little personal input on that. My son has kidney stones and has had reoccurrence of them. And he recently received a phone call. He's 24 years old. And he said, Mom, Harrison called today and asked about my emergency room visit. I'm like, well, that's really nice.
I'm glad to hear that.
Yeah, very, very good.
Anyway.
Let's talk about the Heart Center, the Heart Surgery Center, Heart and Vascular Center at Harrison.
Got it.
What's happening?
Okay.
It
Tom,
is
you can take that one.
not only about 6 years in our community now, Tom?
Harrison has had heart surgery for about 6 years, and it has really grown to an impressive program. The clinicians involved are really second to none, and the response we receive from the community, the people who have been patients, we frequently have reunions where they come back together, and the emotion and the personalization of those events is really, it's amazing.
They got to stay right here at home.
It's important.
on the fact that the reunions are growing almost too large to hold anywhere, which is a great sign of a cardiac program, is that there's way too many folks who can come back year after year, which is a great outcome from the results. The investment that we're putting into a heart and vascular center really is again part of that visioning to say what's the next natural evolution of this program. What does the community need? What do our physicians need to be able to share their skills and knowledge and talents with their patients? And how do we create the environment that's the most welcoming for the patients to do that in? As everyone knows, healthcare technology is expensive. It's also complex, and sometimes it requires facilities to be updated. And everything from the amount of cabling and power we run has changed in the decades that heart care has been a technologically driven industry. And so Harrison is no different. And as we've looked at our investments in our heart care in the last couple of years, we realized we were at that point where it was not only time to continue to renovate the spaces as we always have done in the technology, but to actually create a new space. The flow of the way the patient moves through our environment, how stressful just the moving from one spot to another is on a patient and their family. We've realized we have opportunities to be able to simplify that, make it smoother, make it easier for our staff and our physicians to interact, and make it less stressful for the patient to get that great care that they need. So we're actually dedicating over 10,000 square feet of the first floor of our hospital, taking services that are there were not direct patient care space, and we're moving them out of the hospital to make room for more patient care space in that easy to find location, and really bringing 3 initially, but over time more completely modern technology and spaces for cardiac catheterization, electrophysiology, and all of the things associated with the care those patients need. So it's something that should come online in July of this year. It's over a $14 million expenditure, but we think it's a great investment in the care of the community.
This is the part of the heart program that is not surgical in nature necessarily. Okay, these patients, it's much actually less expensive and safer for them to have the catheterization procedures and the stenting that goes in and opens the vessels up than to have the surgery, okay? And so that's what this is focused on. The surgery remains in our operating suites, and these patients, if they are not successful in opening the veins, then they become surgical patients. So there's 2 sides of cardiac care.
How about a recent 3-star rating for the Heart Center?
Sure, and that goes right along with that's a part of the surgical program actually, and the results that we've gotten there. There's a Society of Thoracic Surgeons have awards or recognizes the top 10% of the hospitals in the country based on outcomes and service to their patients, and based on many variables. And we were just recognized as being in that top 10% of over 900 hospitals that are to provide open heart surgery in the country. So we're extraordinarily proud of that.
In 6 years. That's awesome.
Yes, absolutely.
Congratulations.
Thank you.
Next topic, let's talk about the 2010 March for Babies. That sounds like something new.
Well, it is for me. I was asked by the Regional March of Dimes organization if I would chair this year's Walk for Babies, which is on April 17th. And because we're so involved with the prenatal and postnatal care of children in this community, we deliver over 2,000 babies every year. I said yes, it would be a great thing for me to do. And so prematurity is the issue. We're raising money to fight prematurity. An infant who is born premature, the cost of their initial delivery and care afterwards is 10 times the amount of a normal newborn. In other words, a normal newborn is around $4,500. A preemie is $45,000. That's an awful burden to put on new parents, plus the time. Sometimes these children would be transferred out of Kitsap County because we don't take care of their very small babies. They go down to Tacoma or over to Seattle. So this is a big deal, so I'm hoping that we can engage the community and go out. Our goal is to raise $146,000 in Kitsap County to support the March of Dimes in their fight against prematurity.
Excellent.
Thank you.
A very historic event in our community is the Festival of Trees. I just want to touch on that briefly. It is historic, fabulous event. I understand the 2009 did benefit the Was it the
Heart and Vascular
Heart
Center.
and Vascular
Exactly,
Center?
it did. And we raised, I think, over direct cash that over the weekend was over $280,000. The net of that is something, of course we have expenses, but still the community came through, and the festival for us has always been about raising funds, which has raised a good deal of money over time, but also raising friends. What I say is making people aware of what we're doing. And so the festival has, I think it was its 23rd year last year, and this coming year will be its 24th year. And so we're proud of what it's been able to do in helping the hospital accomplish its mission. And of course, I want to thank all the volunteers, and there's literally hundreds of volunteers that make that happen.
Yeah.
It's probably the premier, one of the premier fundraising events in the community.
Excellent event.
Thank you.
Scott, Tom, wonderful to have you today. It has been eye-opening. I hope we've all learned a little something more about Harrison Medical Center. Can you share the Harrison website with us, please?
HarrisonMedical.org.
HarrisonMedical.org.
Right.
It's wonderful.
www.
Yeah, just go and check it out, and you can see babies.
Yes.
You can get information on everything Harrison has to offer our community.
Quality too. Quality results are now posted about many key core measures in the organization. So people should look.
Great. Thanks for your time today.
Thanks, Shar.
Thank you.
You did a great job, and thanks for joining us around Kitsap. We'll see you next time.